Dr. Walter Ehrenfeuchter.
Yep.
Dr. E.
Yes, that works.
Thank you so much for coming and talking at the 2019 GOMA Fall Conference.
My pleasure.
You're still teaching here at Georgia PCOM?
I am.
Yeah, and still having all of the students and learning everything that you've taught. Have things changed since you've been, when you've started? I mean, you've been doing this for
yes.
11 years now, I think.
15.
15, oh, excuse
15,
me.
I was, well, at this campus.
Yeah.
Oh, good Lord. If I'm coming up on 40 if you count both campuses.
Oh, is that right?
So,
oh
yeah.
my gosh.
Well, I did my residency, started teaching after my residency, finished my residency in 1981 in Philadelphia. So was in Philadelphia until 2005. 2005, I moved down to this campus.
I see.
Long time.
In education,
Mm-hmm.
for at least for as far as manipulation is concerned, what do you see has changed so much?
Mm-hmm. The big changes have actually been in our understanding of how things work. We've known empirically that manipulation works. There's a growing body of evidence supporting its effectiveness for a variety of conditions. But the why, the what's happening, even simple questions like what makes the pop when you do a high velocity thrust technique, have been unanswered until just the last couple of years. So the new microtechnologies, functional MRI, there's been a lot of things going on globally, really, looking at manual medicine in general, that's been actually demonstrating exactly what it is that we're doing, giving us a better understanding, and therefore giving us a better set of indications and contraindications and thoughts about, what are we doing and why are we doing it?
Right. So the techniques are same, but we now understand why we're doing what we're doing, basically.
That's correct.
Oh, that's so neat. The title of your talk was Instant Osteopathy.
Yes.
I'm intrigued. What is that? What do you mean by that?
Sure. Instant osteopathy was a name given to a technique called facilitated positional release by the students of Stan Shiowitz. Stan Shiowitz at NICOM actually developed the technique originally, and he did not have the patience to sit still for prolonged techniques or do multiple techniques when he was treating a patient. And so he figured out ways to speed things up. So he took basically an indirect myofascial release type of technique that typically takes somewhere about a minute and a half to be effective, and sped it up to 3 to 5 seconds, which was a huge difference. And so seeing that rapid technique led to the moniker instant osteopathy, but its official name is facilitated positional release.
And from my perspective, and correct me if I'm wrong, it seems like it's basically counter strain with just a little bit of pressure to kind of shorten the muscle. Is that a...
That's a valid description, yes.
Yeah.
The only difference is you're not monitoring tenderness.
Right.
You're monitoring the tissue texture changes that accompany the typical counter strain point. You can monitor tenderness, but if you ignore the tenderness, you at least then can also use this to treat people with acute injuries where they're going to stay tender. If you got a sprained ankle, it's going to be tender.
Right.
But you can actually use these facilitated positional release techniques to help reduce the edema, reduce the pain, but you have to ignore the tenderness piece of it. You're working totally off of tissue tension.
I got it. Well, thank you once again for coming out and talking this evening.
My pleasure.